the surgeons were talking, and I had to politely interrupt and say, "Excuse me, is it okay if I go get me some water? I'm feeling a little faint." Okay, whoa. Now me almost falling backwards in this chair. All right, I am officially halfway done with surgery, part 2. Been there, done that 6 months ago, but this time we're halfway done, for real, for real. There will be no more repeats. I have completed plastic surgery and cardiothoracic surgery. In several cases, I did a lot of clinic for plastics, and that's where I found out that they also do hand surgery. I was like, oh, I thought that was an ortho thing, like orthopedic surgery. Yeah, I still don't want to be a surgeon. Yeah, there's that. I have, at my church, we've been doing this Bible study for 8 keys to avoid living a miserable life. And one of the keys is acceptance. And so leading up to this point, I've literally just been like, I can't believe that I found myself in this position again. Like, what am I doing? What's going on? Type of thing. But I'm here. And although I don't really agree or like that I'm in this position, I have accepted it for the simple fact that it will make me a better clinician. I had not mastered simple concepts of surgery, and not just that it's surgery, but whatever field I plan to go into. Like, as a diagnostician, I need to be able to see certain things, recognize them, and then send them to the specialist that they deserve to be in. So I have been strengthening my foundation. My percentages have definitely been up. I still have some days where I'm getting 40 and 50%. I'm just like, okay, need to work on that. But all in all, I'm very happy that I'm almost done. It is Memorial Day. I'm in Detroit. My friend who just graduated a few weeks ago got married to the love of her life. And that's been a time. My flight is in for a few hours, scheduled for late checkout, so that's in 10 minutes. So I'm gonna have to wrap this up real quickly. But I'm gonna go get me something to eat and then probably sit down and study because my flight isn't for another 8 hours. Yeah. Another 8 hours. So I have some time to explore if I want to, but likely just study because I haven't studied since Friday. So I don't typically take the whole weekend off. I'll study on Saturday, but I've literally had plans and been running. And I need to text my team to see what time I have to be in tomorrow. I'm on general surgery for the last 4 weeks. We're gonna make the best of it. This entire experience, I'd rather spend more time in the clinic than in the OR just because I'm a clinic girly through and through, and also my experiences have not been the best in the OR at this hospital. As in my last service, I didn't really get to scrub in. And by really, I mean I didn't scrub in for any surgeries. And if I'm going to be there on a surgical rotation, I prefer to scrub in. Although I'm not going to be a surgeon, I still think that there are certain things that are very cool. Like, when am I ever going to touch a beating heart? When am I ever going to get so close to like someone's brain, their lungs, their liver, their gallbladder, the pancreas? Like, when is that going to occur? So let's make the best of this experience, this opportunity, and also I'm paying for it, and it's a very expensive education. So I just want to get all the feels. I have studied with one of my friends who's applying to neurosurgery in 2 years. I still study with my study partner, and yeah, I'm quick to ask for assistance. I don't think it's above me. So we're just gonna keep rocking it out. Exam in less than 4 weeks. Let's get it and be done with surgery forever so I can be a 4th year medical student. Since I'm in Detroit, I'm gonna do whatever the little thing is called. Okay. We'll be out. Catch y'all next time. Bye. And we're back. General surgery, first day for 4 weeks. All right, I'm going up to meet the team. I just came and dropped my stuff off in my locker. And so, yeah, hopefully they're nice. I didn't go to the OR today. I was in Surgeon Clinic, and then we did a tumor ward meeting, so I can tell you all about that. I'm about to leave the hospital and head to campus for a quick meeting. All right, so I have been on several oncology cases before, or like services. Oh, wow, it's about to be a dang on accident. How fast they're driving in this parking lot. Okay, because I don't know what the hell is going on. Anyway, I've been on gynecology and oncology, neuro-oncology, hem-onc, and now surgical oncology. And I've always heard them talk about tumor board, which is when you're in the room with multiple physicians, surgeons, like primary oncology doctors, so medicine, oncology, and radiology oncology. And Basically, you discuss the next steps for a case and whether, or like what the next intervention is supposed to be, whether that is surgical or medical intervention like radiation and chemotherapy. So we did that today. It was pretty cool. They pull up the scans for the patient, and whomever is the primary provider, they're the ones to present the patient. So after that, we went back and spoke to one of our patients on what the next steps were. And now I'm heading to campus. So I avoided the OR today, and I was in clinic all morning. It was pretty slow running, as I actually only saw one patient on my own. I wrote 2 notes, I believe, maybe 3. But yeah, it wasn't too bad. I'm really tired since that wedding over the weekend, but I'll likely be able to study at least 3 hours today and work out. That's the plan, to get back on a good routine. So let's get to functioning. All right, can y'all see me? What we looking like? How's life? We good? Ooh, Chile. So today was really a day. I had 3 cases. I had 2 breast excisions of a duct, and then an incarcerated hernia, which is an emergency surgery. And a hernia is when bowel comes through the fascia in your inguinal, or in your inguinal canal. So basically the fold of your leg, bowel can come through. And so yeah, that was an emergency surgery that we had. So our cholelithiasis case, which was a cholecystectomy. 2 cholecystectomies got bumped for that. And I think another surgeon wound up taking our other case. But this is what I really wanted to tell y'all. I got in that first case. I got in the OR, I was like, it's hot. It is hot in here, and that's very unlikely for me to say that any place is hot, because my body runs cold. I'm always freezing, and I'm never hot. So when I felt that, I was like, oh God, this is about to be a doozy of a day. So I'm scrubbed in, and we'd removed what looked like a cyst from the breast, and the surgeons were talking, and I had to politely interrupt and say, excuse me, is it okay if I go get me some water? I'm feeling a little faint. And they were like, oh my gosh, somebody get her a chair. Somebody get us some water. Somebody, da, da, da. And I'm just like, my very first time in the OR, I literally passed out, and I felt like that all over again. And back then, I didn't have the words for it, but now I know, I was about to have vasovagal syncope, which basically, I believe it's your blood pressure drops, and maybe your heart rate increases, you get really warm, and then you feel faint. That was me. I was warm, I was hot. And I almost felt like things were slowing down. And I felt nauseous, and I obviously felt like I was gonna faint. So one of the PGY2s, the 2nd year resident, took me out back to pre-op, which is the pre-operative space. Oh my gosh, it's always an alarm. Come on, ambulance. Anyway, it took me all the way back to the pre-operative space, got me 2 cups of water and some crackers. And then a nurse saw me eating the crackers and was like, oh, that must be real good. And I couldn't even joke with her, bruh, I was about to pass out. I don't have time for jokes and games. But so that was the first case. The second case, it's a different attending. And then the chief resident was like, if at any point you feel like you get lightheaded and you're gonna pass out, please sit down, it's okay. And then the attending was like, yes, absolutely, sit down if that happens. Did you eat breakfast this morning? I'm like, yeah, I had pancakes, a protein smoothie, and 2 pieces of bacon. She was like, your breakfast was better than mine. I'm like, yes, I'm trying to tell you, I was just warm this morning. I don't know what it was. But what it was the room was very, very hot. And when we came in for the second and third case, y'all, was cold. The hair on my arms was standing up. And I was like, that's how I like it. Because once I put this gown on, I got the extra mask on and these gloves. Now I'm normal temperature. But it was warm for the first one before I was gowned and all the jazz. So that was those cases. The last case, I had to ask, hey, can I suture to close? Because they weren't offering. And the resident was like, oh, have you done this before? And I was like, yeah, I have. And so then I did it. And she kept telling me oh, you did such a good job. You did such a good job. Have you closed it before tied, buried the knot? And I was like, yeah. She was like, okay, we'll practice together on the suture kit, and then the next case you can do it. And I was like, cool. And so I think tomorrow we have like, they said it's a whole bunch of cases in the afternoon and just one in the morning. So yeah, that'll be tomorrow. So yeah, all in all, today was a good day. The team at this hospital, they're so nice, like very nice. The chief resident was like, yeah, I'm gonna go grab me a sandwich. It won't be fast. Like, it'll be fast, won't be long. She's like, wait, y'all need to eat lunch too. And I'm just like, I ain't never had a surgical resident tell me I need to eat lunch. So shout out to you. Appreciate you. All right, time to study. See y'all tomorrow. It is almost 1:30 and I'm dressed now, about to eat lunch. I had 2 OR cases, a cholecystectomy and a hernia repair, and now I gotta go to clinic. Like, oh child. And all I really want is to sit down in some peace and quiet. My father didn't call me because I usually would have spoken to him by now. It's an unusual day, y'all. I want some sleep. And this is where I'm choosing to eat lunch. Because I don't want to eat with other people. I didn't want to eat in a lounge with the nurses. I don't want to eat in this little lunchroom over there because it's 2 people. And I want to call my father. So here comes the peace and quiet I was asking for. I just want to say, God is so good, because I just got to clinic and apparently the attending that I was going to be in clinic with does not like it when people wear scrubs. And clearly I came from the OR, so I have on scrubs. And so the senior was like, you're dismissed, go home. Like, literally, be done. And I said, girl, you ain't got to worry about me. Not about me, maybe somebody else. So I'm going to the gym. Then I'm gonna go home. Now I'm like, dang, maybe I should not have eaten my lunch and I should have went straight to clinic, but I would have passed out. So I did the right thing, but yeah, me. Yeah. I have studied for 5 hours today, reviewed for my surgery mystery case, and I also have to do a case presentation, and then I will give feedback and receive feedback as I'm at the 5th week of my rotation for the 2nd time, and I take my final exam in 3 weeks. So yep, I'm supposed to log on right now. I'll give you updates once I log on. All right, so she hasn't logged on yet, but I'm about to give a case presentation on a thoracic aortic aneurysm surgery that I observed while on cardiothoracic surgery. And then I don't really know what my mystery case is going to be. It's between acute or chronic limb ischemia, aortic aneurysm. Wait, what is it? Abdominal aortic aneurysm, any GI hemorrhage, appendicitis, gunshot wound, and gallstone pancreatitis. So I took mad notes earlier as I was reviewing it, and let's just wrap this up, get this out the way. I studied for, I told y'all, 5 hours, and I finished my UWorld questions. I only have 6 questions left, and I have actually moved on to completed AMBOSS questions, and I'm going to do a practice exam tomorrow. So yeah, there you have it, folks. It's 4:43. Still ain't got in this Zoom room. It's supposed to be 4:30 to 5, y'all. I got plans to leave my house at 5 o'clock. We're gonna have to reschedule, like I fear. And I hate that for me. But what I dislike more is my schedule being thrown off. And I really got some plans, so stay tuned. So I obviously have on different clothes because today is a new day. I did not get to have my midterm feedback or my midterm exam yesterday because the doctor was running behind schedule. We were scheduled in 30-minute time blocks, and today they were just like, yeah, I think I just talked too much. And I'm just like, I mean, okay. And so rescheduled for this morning, and it was supposed to be at 9. And then when I was about to log on at 9, I saw an email saying like, I'm running 15 minutes late. And I'm just like, okay, cool, no problem. But I didn't get a lot of sleep last night. I literally was getting dressed when I was about to log on at 9. So by the time 9:15 came, I didn't get to eat breakfast, hadn't slept. I'm just like, all right, this is about to be a doozy. We were on Zoom for 1 hour and 15 minutes. Definitely was not anticipating that, but I'm going to tell you all the good things about what came out of this midterm feedback and exam. Okay. So we started off with feedback on me and like, how are things going for me at this new hospital since I'm not at my hospital as I was last time. Expressed how I'm always actively involved in participating in our Friday mentor sessions with the questions and just like
whenever she's asking anything, I'm just out there because like, I know I need to know this material, not just for the surgery exam, not just for step 2, but for my future patients, right? I won't be a surgeon, but they're like, these are fundamentals of medicine. And then we went into my case presentation, and I was like, oh, I had this patient that has a past medical history of Marfan syndrome and polysubstance use disorder, presented with chest pain, fatigue, dyspnea, and palpitations. On a CT angio, we found that they had an aortic aneurysm that was greater than 4.5 centimeters. We took them to the OR, gave the vitals, and talked about the procedure, like what did we actually do, the operative course, and then the complications and the literature and how it backs it up. The feedback that I got with the case presentation was know enough to tell us what happened during the operation, like the course or whatever, but I gave too many details, which made her start thinking and start asking more questions, saying like, oh, well, this part isn't clear. She was like, the goal is to be confident and just saying what you say and know what you say. She's like, because you're very bright and you typically have all this confidence, like, but right now I think you just gave a little bit too much. Like, remember, surgery is quick. And I was like, yeah, I kind of forgot that. So that was good. And then we moved on to the mystery case. They went above and beyond. So last time when I did this, I think my whole feedback session was like 25 minutes, because it's 30-minute blocks. As I told you, we were on for 1 hour and 15. And it was like, okay, so they give you a patient, like patient X present to the ED with the symptom. That's all you get. And I have to go through like, okay, well, say a symptom, how long has it been going on for? Has this happened before? Do you have any associated symptoms like nausea, vomiting, diarrhea? Have you had a fever? Do you have this? Do you have that? And so I'm focusing in on one organ system. And then they were like, okay, so are you done with that organ system? And I'm just like, yeah, sure. So, okay, what organ system you want to go to next? I'm like, oh, okay, well, let's think about it. So I went to another, and then after that, I went to another one. But still, you have to ask all of these questions. And then from there, you go to the physical exam. And the first thing, whenever you get to physical exam, this is for a mystery case, this is for real life. What are the vital signs? Like, if the patient is hemodynamically stable, which means if they are afebrile, they have a normal heart rate, respiratory rate, and blood pressure, all right, this is not an emergency. If they are not hemodynamically stable, we need to immediately get them to the OR. If it was like some trauma, or I don't know, if they're decompensating, and they're on the medicine floor, then we need to know, like, what is the decompensation for? Like, is it because of shock? Like, basically, it's emergent. I would bypass a physical exam if they are hemodynamically unstable and, like, their stats are plummeting. So my patient was stable. So then I, after doing that, then you need to, like, look before touching, because that can also guide your differential diagnosis. We talked about obstipation versus constipation. Constipation means like, your bowels are just having difficulty getting out. Like maybe they're coming out in small increments. You're still passing gas, but obstipation, there's no flatus, which is no gas being passed, no stool being passed. And that means you could have a complete obstruction. So that could be small bowel obstruction or large bowel obstruction. And then after doing that physical exam for like the first system that I asked, I need to do the physical exam for all of the systems that I asked history questions on. And then from there, they were like, okay, what's the differential diagnosis? And I'm like, can I get the labs? Can I get some imaging? No, you're going to give me a differential right now. And I was like, okay, cool. But based on my physical exam, I knew exactly what was going on. And fun fact, I got the exact same case as I did last time, but based on the way that it started out, I guess I asked different questions. I didn't think it was what it was last time. I thought it was something completely different, like had a different differential in my head before the physical exam. And this is something that I shared at the end, and they were like, okay, and I'm happy that this happened, because I don't want you to ever get so narrow-minded that you miss out on clues, you miss out on a diagnosis, and your patient suffers. So it's okay to come in having like some idea, but don't narrow your questions towards what you feel the diagnosis is. And I was like, true. So happy I didn't do that, because I'm just like, I was definitely going somewhere else. I mean, same vicinity, but not the same thing, wouldn't have gotten it correct. So after labs and imaging, then I said exactly what the diagnosis was. And then we went through like the rubric together. I got 90%. And I even told the physician, like, look, I think this was very, very helpful. The lectures you've been giving yesterday, I got some questions correct based off the lecture you gave yesterday morning. And today, like after going through this mystery case with you and you going through all of the systems, like it showed me that I do have a lot of knowledge, right? but I still need to organize my knowledge. Like, I forget in 1M2 year, they're always like, okay, we're gonna do review of systems head to toe. So that means like literally all the questions, if I'm asking about the brain, let me ask all the brain questions right now. And then if I'm asking about the heart, okay, let's ask all the heart questions. Don't just go like jumping all over the place, because when I'm thinking about it, like that's also scatteredness with that as well. So did that. And then I even asked like, hey, so this was so amazing to the point where like, if I have like, can we do this again? Like if I have any questions on content that I struggled with the first time and I'm still struggling with, can we do like not a mystery case, but a mystery case, but maybe it is a mystery case? Because I want you to just do that patient presentation and I have to know like, okay, these are all the things that it could be. Like if they present this way, okay, but based on this is more likely this, you know, like aortic dissection, pancreatitis, and let's say abdominal aortic aneurysm, they could all have somewhat of a similar presentation, but if I hone in on, is it the hypertension, is it the smoking, is it the alcohol, you know, like, is it the age, like what are all the different factors that can lead me directly to one thing? Or something that has a wider mediastinum, is it esophageal perforation? Is it, I think a dissection also has a wider mediastinum. Either way, like what I'm trying to get at is, I love the way she did that. Like they ate that up and I need to eat that up on my exam. So it showed me that these are, again, areas and rooms that I thrive in, where you're encouraging me, guiding me, and kind of pushing me a little bit to like dig deeper. Like even when I would say, oh, I'm not too sure about that, they did not just say, okay, well, it's this. They're like, okay, well, what's another way that I can kind of present this where it'll click? And I'm just like, oh, you're talking about, and they're like, yeah, distension. And I'm like, yeah, I thought I had said distension, but obviously I had not, you know, something so simple as that. So yeah, I'm very proud of myself for taking the lead on my own education and knowing that there are resources out there, there are people out there who are willing to help me, and I have to do my part with following up. So yeah, I got 90%, almost certain I got 90% last time, but at this point, I feel a lot better with where I am and where I'm going, and we'll see where we end up in 20 days when I take that exam. I will catch y'all in the next video. Bye.